Do root canal treatments actually work? Now, you might have been recommended by your dental professional that a tooth you have needs a root canal treatment. There is a good chance that that tooth has pain, and that's why you have been recommended to do a root canal. It's not something you would want to do. Usually people say, I don't want to do a root canal treatment, nobody wants it. But it's a treatment you might need, and it can save you from pain, infection, it can save your tooth there. But why would you be recommended to have a root canal treatment in the first place? First of all, the only reason that you would need to do a root canal is that there is an infection inside the root of the tooth. The name suggests that, right? So how does this happen? Usually, not always, you got a cavity in the tooth, it has not been treated, and that cavity got bigger and bigger. The bacteria inside that cavity basically uses your tooth as a source of food and energy. Yum yum, they use your tooth, and their byproduct, basically when the bacteria go to the bathroom, they produce acid. The acid will dissolve the tooth structure because our teeth are made of minerals and they become demineralized. So the acid will dissolve the tooth structure, leaving behind soft, gooey tooth structure, which is not useful. But this also helps the bacteria grow, so they colonize over there and they become more and more, and then eventually they go deeper and deeper into the tooth. You have layers of the tooth to pass before you reach the nerve of the tooth. First layer is your enamel, the one you see from the outside, these. Second layer, couple of millimeters deeper, is your dentine. Dentine usually has sensors, so usually you should be able to feel some pain, sometimes to sweets, sometimes to cold and hot temperature. But sometimes you don't feel anything because your teeth don't have as strong nerves, or their nerves are much deeper, stuff like that. People have different threshold of pain and sensitivity. So if you don't do anything about this cavity that keeps growing, it goes deeper and deeper, and eventually it's going to reach the nerve of the tooth. The nerve of the tooth lives inside a pulp chamber. There's a little chamber, imagine a little room inside your tooth that holds the blood vessels and nerves. So many of us think that our teeth are just dead objects inside the mouth. That's why we don't really think that this is connected to our whole body via our bloodstream. If it's ill, if it has infection, it can literally go everywhere. It could eventually cause death. As if you Google, you can see that some people, even recently there was a famous person who died because of a dental infection. Now, it might not be that common, but why risk it? So this chamber or room has the nerves and blood vessels of your teeth. The infection is getting closer and closer. You might start feeling pain, and eventually when the bacteria enters the room and infects the nerve will send the signals to your brain that we have pain, inflammation. This pain usually becomes unbearable. People describe it as throbbing, or they cannot sleep at night. It gets worse when you go to bed because all the blood rushes to your head. And also, it doesn't stop by taking painkillers, although it sometimes gets better. Wrongly so, sometimes you are prescribed antibiotics, or you might, people come to me and say, just write me an antibiotic. Or people come to me and say, last time my dentist gave me antibiotic and the pain stopped, why can't you do it? And of course I can. And by law, I can, especially if you have systemic signs of this infection or inflammation. For example, you have fever, you cannot sleep at night, stuff like that. But antibiotic is not the only answer to your problem. Because if I give you antibiotic and painkillers and help you for a couple of days and kill the symptom, that infection is still growing. It does not go away. It's not like the rest of your body that you sometimes can treat the infection only by antibiotics. You're basically only making your body resistant to antibiotics. Now, why is it like that? Why is the infection like that and it doesn't go away by antibiotic? Because it's in a bony cavity. Basically, the infection got to the enamel, got to the dentine, got to the pulp chamber, went down, and from the root and got to the bone of your jaws and ate through the bone, created a granuloma, a cyst, basically a little room for itself inside your bone, full of infection, bacteria is partying there. This cavity gets bigger and bigger. And then the infection can spread from one side to another because our face is made of spaces between fascia, which is your skin, muscles, and the bone. So if it reaches one of these spaces, basically these spaces are like hallways between the rooms. So it can go from this side to that side. You get fat face or big face. You wake up suddenly with a swollen eye. Even it can go from, the upper teeth. So each tooth is connected to a different fascia space, and each space can radiate that infection to different parts of our body. Keep in mind that it can eventually go to your brain or your heart and cause death. Now, as I said, it is rare, but it happens. So what we want to do, first thing first, good oral hygiene. Prevent the cavity. Good oral hygiene comes from flossing, brushing, and seeing your dental professional once every 6 months. Why do you need to see the dentist or dental professional once every 6 months? Because there are problems going on in your mouth and your teeth that you might not be aware of, because they're going to give you pain when it's too late, when you already need a root canal, when you already lost the tooth, when the infection already spreading everywhere. So what you want to do is somebody else look in there and say, oh, by the way, there's a black thing there, let's take an x-ray, right? Every 6 months, get a check. Every year, every 2 years, get dental x-rays done. And stop the problem when it's much, much smaller. If it already happened, so let's say it's too late now, I have an infection inside the tooth, or even if it has spread to my bone, there's a cyst there, there's a granuloma there, and I have pain, and my dentist has recommended a root canal treatment. What are my options? The first option is the root canal treatment itself. And how it's done is your dental professional will remove the cavity first, clean it, clean the nerve, dry the nerve canal, put in a root filling, put in a tooth filling, and then hopefully, most of the times, it will kill the pain unless we have missed something, which can happen because the treatment is very complex. The second option is to pull out the tooth altogether. For example, if this happens to a wisdom tooth, my recommendation usually is to take the tooth out. Now, keep in mind, I have to first examine the patient. I cannot give you one size fits all for all the treatments you need. But in general, removing the wisdom tooth would be recommended because usually you don't need that tooth and it's causing a lot of problems. And doing a root canal on a wisdom tooth, not only it's difficult, it might not be the best treatment that we can do because it's really, really at the back of your mouth. But sometimes we need to keep the tooth, so that is the only option. So your options as a person who has infection inside the tooth is root canal treatment or pull out the tooth. And the third option that we have to give you is do nothing, but it is not recommended. At some point, this infection will kill the tooth completely and the pain will stop. But the infection is growing silently in your body, making you feel ill, lethargic maybe. You're not happy anymore. It can affect a lot of your moods. And as I explained before, the infection can spread to your body. Now, let's say you had a root canal treatment a couple of years ago, the tooth is fine. Does that mean that the tooth is dead, so I don't need to take care of it? No. The tooth is still a source of food for bacteria. So you still need to get your checkups done, regularly, as I said, every 6 months. You need to floss and brush and keep it healthy. The biggest risk with the root canal treatments is that because we drill a lot of the tooth out, and we have to, there has been a cavity and most of the tooth structure is dissolved, even if we don't clean it out, it's going to just get worse. So we clean the area out. Because you've lost so much of the tooth structure, there is a very good chance that the top of the tooth breaks. That's why most dentists would recommend to have a crown placed on the surface of the tooth to hold it together. If you want to know more about crowns, have a look at the video that I'm going to tag above, and it will explain for you what crowns are. Thank you so much for watching. I'll see you at my next video.